All right, so welcome to the 5th installment of our PCA and HCCN Professional Development Series. I am Suzanne Spear. I'm the Senior Director of Workforce Development here at ACU, and we are excited that you guys are with us today for this session. Of course, okay, there we go. Okay, so I know that we're in the 5th session, but if this is your first session with us in the series and you are new to ACU, just a little bit of background. We are ACU, also known as the Association of Clinicians for the Underserved, is a national nonprofit organization founded 25 years ago by National Health Service Corps alumni. And we are really focused on 2 goals, and that is the recruitment of a clinical workforce and really supporting the populations that they serve, and also supporting the clinicians that serve the underserved populations. So we have changed a lot over the years, but our focus remains the same, and our programs really reflect that. We have several different programs. We have a Suicide Safer Care program, we have a Vision Services program, and then the reason we are here today is because of our STAR Center program, which is Solutions, Training, and Assistance for Recruitment and Retention. We are funded by the Bureau of Primary Health Care to provide free tools and resources for you, the PCAs, as well as health centers across the nation. So if you haven't checked out our website recently, go there and check it out, chcworkforce.org. Sign up for our newsletter, get involved in what we are doing, look at all of our new tools and resources that we have. Good golly, just so much going on there that you're not going to want to miss it. It's jam-packed. It's awesome. Check it out if you haven't lately. And it's always changing. Things are always coming out too. And if you sign up for our newsletter, you will be stay abreast of all of the things that are coming out and that are new, new publications that are approved, all that kind of good stuff. So you can find it all on our STAR Center website at chcworkforce.org. So I am not here alone today. I am joined by the entire STAR Center staff. So we have Mariah Blake, who's our program manager, and she is our Wizard of Oz. She is the person behind the curtain, and she makes it all happen. We would be just totally not sure where I would be without Mariah. And if you're having any technical difficulties, she is your person, and you can email her or you can direct message her in the chat there. We also have Sabrina Edgington, who is our Director of Learning and Curriculum Design on today, as well as Michelle Fernandez Gabilondo, and she is our Senior Training Specialist. So, and there she is. So anyway, we are excited to have everybody on here today, as well as just chatting and talking and interacting with you guys today. And we're going to get started. All right. So, excuse me. So just so you know, housekeeping items. We are recording this, and so we will be sending this recording out to everybody who registered. So if for whatever reason you have to go quickly, or one of your colleagues misses this and you want to send it to them, feel free to do so. It'll come out in a few days to your registration. And why did all my stuff just go away? Okay, can you guys hear me? Sorry, my internet just like totally went out. Okay,
yes,
good.
We can hear you.
Okay, great. Okay, am I back? Like, can you see all my stuff again? I don't know what just happened.
Yep. Can also
see
your slides.
Okay, great. Awesome. Thank you so much. Sorry about that. I have no idea what happened. All right. Also, I mentioned it earlier, but use the chat box. If you have any questions, technical wise, you can contact Mariah Blake, and otherwise just use the chat box to ask questions and share comments. We're also going to do some Mentimeter fun today. So you'll have an opportunity to weigh in there. So use that and interact with us. We also want you please to complete the evaluation at the end of the session. As you know, HRSA and BIPIC require us to report all of that, the evaluations. And we also want to know what you like, what we could do better, and then any just additional thoughts. So that really helps us out when you fill out those evaluations. All right, so this is a slide that Sabrina shared with y'all the first session back in November. I can't believe it. It feels like it's been forever and yesterday all at the same time. And so this professional development series is really sort of a multifaceted series, right? So in a variety of different ways, we are going to really assist you in the work that you're doing. Some of you, most of you probably now, things have changed a little bit. And most of you now have workforce as like one of the big umbrellas that you do, even if you do other things. Some of you might be new to this, some of you might be old hat. But wherever you are in your professional journey when it comes to workforce, this series is for you. We are here to really help you be a trainer, to build your network and keep you informed, and then also inspire you to do the work that you do every day. Sometimes it's just good to just sit in a room, even virtually, with our peers and our colleagues that are doing this work every day, and just chat with one another, just be in community with one another. This pandemic has been so isolating. And so I feel like now community is more important than ever. And, sometimes we don't, get a chance to really just, chat it up during these sessions. But at the same time, I hope that you will feel each other's presence and just really know that we are here to support one another. We're all in this work together, and we're really just here to expand your knowledge, but then also just expand your network, hear from one another, and hear about those promising practices. So that's what we're going to be doing a lot today. We're going to be doing a little bit different. It's not going to be as much of a didactic session. We're really going to be sharing thoughts and ideas today as a little bit of a departure from what we normally do here. And really, so put your thinking caps on, get your fingers ready to type, and get ready to have some fun. All right. So during that first session back in November, we asked a series of questions about TTA, about training and technical assistance. And we asked the question, what TTA requests have come up over the most over the last year? And there was several different choices, and there are a lot of different things that you guys wanted to hear from. But two of the things that really rose to the top were recruitment, how recruitment and retention has been affected by COVID-19, as well as policies that support diversity and cultural respect, diversity, equity, inclusion, all that, the umbrella that goes under there. So what we're going to do over the next two sessions of this series is tackle those two topics. Now, this is ever-changing and a lot is going on. So what we're going to be doing is, especially during this session, is we're going to be talking about some of those things, hearing from you guys, as I mentioned, and just sort of figuring out what we can do to really move forward during this time and as things continue to evolve. So today we are going to be doing, again, the first of those two topics is we are going to be examining how COVID-19 has impacted both the recruitment and retention practices at health centers. Everything has changed, and we're really going to dive into that. We're going to, like I mentioned, we're going to have a group discussion around strategies and issues and problems and how folks have overcome that. And then we're also going to take a look at how STAR Center resources can assist in those things. We don't have all the answers for sure. I don't pretend that, we have all the answers, but hopefully some of our tools and resources can assist you as you are navigating these waters during the pandemic, and also beyond too. Okay, so this is how, when I was thinking about, okay, well, how in the world what has recruitment and retention felt like during the COVID-19 pandemic? Well, this is kind of what I came up with. You just want to stick your head in the water and just like pretend that and just wish it would all go away just because it's so crazy. Just like everything else, our world has been turned upside down and we're just like, I just can't even deal. So I'm just going to stick my head in, under something so I can forget about it. Well, never fear. You have been equipped with the tools and resources that you need to overcome this, whether it is, you personally, or knowing that you have national training and technical assistance partners to help you, other colleagues, and other resources too. So we have the tools and resources that we need, just like the duck does, right? His duck feet, duck fins, whatever he has to swim, and his beak and all of that. So you are equipped. Might not be exactly things that you have, on your person, but you are equipped to deal with this COVID-19 pandemic and the challenges that have come along in the recruitment and retention realm. So let's look first at recruitment and how it's been affected during COVID-19. So these are just a couple things, and this is not a comprehensive list. I want you guys to share in a little bit some more, but just to get us started and thinking about it. Recruitment during COVID-19 pandemic, first of all, interviews have been happening remotely, right? So before COVID happened, before last March, it's almost been a year since everything pretty much shut down. People really didn't interview over Zoom, or very few interviewed over Zoom. It was either like a phone interview or they came in, for subsequent interviews. Well, that's all changed, and everybody's interviewing over Zoom these days, right? It might be first over the phone, then over Zoom, all of that. So really, really having that remote interaction with candidates. Also that, candidates might be reluctant to change jobs or move, especially if it's going to be a provider or somebody that would relocate for a job. They might be challenges because folks don't want to move. They don't want to, relocate during a global pandemic, as well as some positions might be put on hold. This is especially true when it comes to dental. Last spring, dental operations just shut down, as you guys know. So you might have had to, health centers might have had to put those positions on hold and rethink all of that. And then conversely, that some positions need to be filled urgently. There, might need a, slew of medical assistants or nurses or whatever the case may be. It's like, okay, hurry up. We need staff in here to see patients, to do testing, and now we're doing the vaccine. So it really has made us have to rethink and redesign the entire recruitment process. There could be few things that are the same, but I bet that a lot of things have changed dramatically. All right, so this is where the fun part comes in. Who is ready to share? If I can find it. Okay, I'm going to stop sharing for a second. I'll be right back. I'm not going anywhere. Just pulling it up so I can start sharing my screen here. Okay, here we go. So what I would like you guys to do is either to have the barcode, but I switched too quickly. So you can go to menti.com and put in that code 98526397, or you can click in the chat if Mariah wouldn't mind putting it into chat. Awesome. Thank you, Mariah, for putting that in there. And I want to hear from you. What are some of the biggest challenges as relates to recruitment? And, basically just, oops, sorry. I'm all over the place, you guys. Sorry, I'm back on the right slide. That threw me off. So what ways has recruitment been affected by the COVID-19 pandemic? And I know that we're a year into this, but really, in order to understand where we go from here, let's figure out where we started, right? So how have things been affected? And if you would, please put your name and your state before your answer too, because that'll help as we interact with this. So this could be anything from just like hiring freezes to the ways, like the physical ways that recruitment happens, the way where you advertise, really anything that you have heard from your health centers about this. Okay, candidate pool has significantly decreased. Yes, huge. Thank you for sharing that, Anita. Marie from Ohio, okay, says comfortability with inpatient visits. Yes, absolutely. Very true. A lot of folks just want to do telehealth, and that could be affecting that, that they don't, they're not really interested in coming to a job where they had to see patients in person. Anything else? Okay, Ashley from Kentucky, remote work expectations. Yes, again, kind of the same with what Marie was saying about, comfortability with inpatient visits. Yes, absolutely. Okay, this is awesome. Okay, so Katie, question about yours. So it says, we have found more dentists and remote interview works well. So you said that that you have increased your dental pool?
Oh yeah, big time.
Wow. Okay, because they were maybe affected by their former job. So you have you found the pool, your dental pool increased.
I think that, and a lot of the new grads are waiting longer to start to look for positions, which I feel like our health centers are slower signing people than typical. And so we've just found a lot more even new grads that are coming out that we've been able to sign in our state. I would be willing to bet we've got up, 100% of our candidates from what we normally place.
Wow, that's amazing. I mean, that's a silver lining, for sure. And hopefully too, by that, it can have a snowball effect in a positive fashion, that they would, especially those new grads, that they would talk to the people that are, second and third years, that, or, I guess third and fourth years, that they would, just word of mouth about health centers. So awesome. You guys, this is awesome. Okay.
Can I?
Yeah, please.
I was just going to ask with what Katie was saying. I think also too, when we ask these questions, with the health centers, is that it's not all negative in the way that it has been affected. You also need to look at what is working and what's good. So, that effect goes both ways.
Yep, absolutely. Thank you. That's a wonderful point. Okay, so what I'm going to do is I'm going to try to get to most of these, and then anything that I don't get to, we're going to sort of put into a best practices document to get out before the next session. Okay, just so many. You guys this is awesome. Thank you. Sorry, I'm trying to figure out how to see all these. Okay, I'm pushing enter to pause scroll. Okay, health centers are not reaching out to candidates in a timely manner. So kind of flipping it back again. Yes, and that could probably be because, and if, oops, sorry. Emma, are you seeing that they just don't have time, and so that's why they're not reaching out to candidates?
Yes, they're just overwhelmed, which I try to tell the candidates that we refer to the health centers that, but I can remember being a candidate and becoming frustrated when I was job searching and didn't hear anything back.
Yeah, absolutely. It's very frustrating for the candidates. And even though we're all kind of swimming in the same boat, it's still a reason that people lose candidates. And when I did direct recruitment too, it was one of the biggest reasons why we would lose candidates, is because folks weren't reaching out in a timely manner. And it's hard because we only have so much time in the day, and with so many things changing, that's really hard. But that's tough. So thank you so much for sharing. Okay, let's go in this. Okay. All right. So Robin from Idaho said that in-person interviews are not happening as often. Absolutely, yes. And having to strategize around flexible hours, trying to get that coverage and figure out who is, who's going to be there too. Awesome. Okay. Let's look at some other. Okay. More competition between health center and hospital wages. Yes, Shalena, 100%. I can imagine that more than ever, that health centers are really having to compete with hospital systems on this, and it could definitely be something that would really be a challenge. So, okay, what's going on in California? So talking about hybrid recruitment processes and protocols, so that remote and in person, and also prioritizing volunteers for vaccine distribution or administration rather. And that is a whole nother thing that is sort of another part of all this. It is not just like normal health center operations, but especially if either through the national rollout from the feds giving the 250 health centers the vaccines, or some states are just prioritizing health centers as a administrator of vaccines too. That could also that could really also affect the recruitment process too, because they just need people to get those vaccines out. Yes, 100%, absolutely. Okay. So Yadira from Washington said no in-person contact and lack of support staff. Yes, I have heard a lot of this, and I don't know if you guys can see this as well or have seen this, but I've heard that a lot of folks the support staff are, especially in the beginning, and I don't know if this is the same way it is, but a lot of folks have really had issues keeping their support staff because their unemployment is higher than their wages. And so, while obviously employment is so necessary, especially during this time, but that it's just kind of like, well, I can remain furloughed or, whatever, and make more money than I was at the health center. So that's really tough too. And if you don't have support staff, then that just throws everything off at the health centers with that too. So, okay. I am going to look at one more, and then we will go. Sorry, the way this is scrolling is kind of all over the place. Okay. All right, I think we got to most of them. There were some that we didn't get to. Okay, and another from Nevada saying about compensation too. That's been a really big one, especially right now. So awesome. Thank you guys so much for sharing on how recruitment has been affected. All right. So conversely, what have health centers done to overcome their recruitment challenges? Sorry, I started out with this one slide first, so I apologize. So you guys have already put it in. So, okay, so we've talked about what have been their recruitment challenges, and actually a couple things that have come out on Katie and others that have shared, about the positive things. So, but what have health centers done to overcome their recruitment challenges? So compensation. So conversely, we talked about how compensation was a challenge, but then that's also how they have used it as a way to overcome it. Okay. All right, hiring freezes, right? So that's how they have overcome their recruitment challenges. So they've just kind of put a stop to recruiting, and they're just saying, okay, we're going to work with what we have, and just not even go there right now. That's one way of doing it. And then, so Ashley from Region 8 said that they had some hiring freezes right on. Obviously, that goes with the first one. And then, Lourdes from Arizona put in virtual interviewing follow-up. Sorry, let me move my things. Okay, yes, and that gets to our next sort of conversation around retention and how retention's actually probably been positively affected because providers don't want to move around, so they're just sticking where they are, and just even though if they might want to move later down the road, they are not doing it right now because they don't want to move in the middle of a global pandemic. How else have health centers overcome their recruitment challenges? Anything else that you guys want to share? Okay, so Rosa at the North Carolina PCA said that they're identifying ways to place staff in other positions and cross-training. I think this is probably one of the best things to come out of, one of the best things that have come out of this is that that cross-training. So people who might never have been exposed to other aspects of an operation now are, and obviously it's because of necessity, and maybe they don't want to do that when things get back to normal, whatever that might be, but that they have been exposed to that. And I think that there's so much growth that happens there, both on a personal level, but as an organization, because people tend to understand exactly what goes on. And I think having that bigger picture really helps with, it just helps a lot of things. It helps with, pride in what they do and with the organization and all of that. So that camaraderie is helped there too. Okay. Okay. So Katie from Iowa mentioned interviewing on weekends, and I assume this is to minimize the exposure level when folks are in the office. So that's great, and that is wonderful that health centers are seeing that that's an option, and really going above and beyond to make those interviews happen in a safe manner, that and can keep the process moving forward too, because I think sometimes it kind of stalls, like we were talking about previously, that people just don't have time. So okay. All right. So Isa from California was going on a theme about volunteers, is that they have been a part of the solution, but have also presented challenges. So particularly if the volunteer is wanting to help for more than 90 days. So I'm assuming that maybe there has something to do with California law that talks about the stipulation of volunteering over 90 days. So that definitely could be an issue, and something that, is really, you have to figure out, it's kind of another challenge you have to kind of figure out a solution to. That's
Suzanne?
Wonderful. Yeah, please.
This is Isa. Yeah, no, I'll just share that the 90-day piece is actually a HRSA credentialing piece. So,
I didn't realize that. Thank you for teaching me something.
Yeah, it's, we're learning as well. So I'm not sure how familiar folks are on the call, but if for specific clinical positions, HRSA allows health centers to extend their liability coverage, specifically their FTCA coverage. If the health center submits they undergo this temporary credentialing process, which is not as intense or administratively burdensome on the health centers. And so, but the caveat to that is that temporary credentialing privilege is only extended for 90 days. If it goes beyond 90 days, the health center is required to go through the full credentialing process for that health center. And so the challenge has been, there's been a lot of volunteers or clinicians who want to volunteer at health centers, but have limited capacity. So for example, they might be a retired physician or might just be non-affiliated clinicians. And so can't necessarily commit to as much. And so I've been hearing is that health centers are just not sure whether or not they should allow them to volunteer because of this hurdle. And so, but something that some health centers are doing to kind of address that credentialing piece is that they're working with their academic partners. So any sort of institutions that provide them volunteers or residents to create or generate a letter of good standing for that volunteer that just speaks to the volunteer's background and helps meet some of the requirements for the credentialing pieces. So, yeah.
Awesome. Yes. Thank you so much for that, Isa, for educating me as well as other folks. And thank you to Judd for putting the FTCA page, the HRSA FTCA page for volunteers up there. So just in case your health centers are wondering about that and figuring out how they can really incorporate, I just froze again. So hope that's just on my end and you guys are still seeing that. But anyway, because I know that a lot of that with the vaccine rollout, a lot of folks are using volunteers. So all right. Okay. Well, thank you guys all for sharing. Let me do one more. Let me move my chat for a little bit. So Shalena from Michigan shared that they are looking at attractive compensation and benefits, things like childcare and signing bonuses to overcome those recruitment challenges. So yes, lots of things that have changed and challenges and way for things to overcome. But at the same time, I think that really speaks to, all of this really speaks to the fact that health centers are innovative and they're really figuring out how to overcome those challenges. All right. So we are back. Can everybody still see, can you still see my screen? I'm frozen on my video is frozen, so I just want to make sure you guys are still seeing my screen.
Suzanne, we can see your screen. It is where it's on the poll slide.
Okay. All right. Did it just move?
Yep.
Okay. I'm going to turn off my video for right now because I don't know whether it's my bandwidth. I'm sorry, you guys. Just having a crazy afternoon. Okay. So there are obviously a lot of ways that you all are already helping your health centers figure out how to overcome these challenges and how they're figuring it out, right? As I mentioned, health centers are really nimble and they're really good at what they do and just pivoting and figuring it out. But one of the things that you can do as a PCA is to really help them, obviously there's so much focus on with HRSA and BIPIC and all of the different things with workforce. One of the things that they're asking you guys to do is to help them come up with a comprehensive workforce recruitment and retention plan. So a lot of times what really is a great thing to do when someone's coming to you for help when it comes to recruitment, is really getting back to the basics and looking at their written recruitment plan. Like, what do you already have in place and what do you need to shift and focus? Like, how do their recruitment teams and roles need to be adjusted? When could you interview? Katie in Iowa talked about bringing people in on the weekend. So really looking at your existing plan and figuring out how you might change that up to accommodate the unique needs of right now, right? And so helping them to be open to changes and adjustments. If there are limited candidates, trying to figure out, what are our top priorities in that position, and looking at, okay, if you normally had a pool of 10 candidates and you're having to choose from that many people, well, now if you only have 1 or 2 candidates, and really trying to figure out your top priorities for that position and looking at that position and taking a look at it. And so, while it's certainly not the only answer, but if they start out with a written recruitment plan, or even if they don't, then you can really help them hone in on those specific elements that might be be addressed, and that you can really get to the root of the problem. Because I think sometimes these problems or these issues feel so big, and that if you really just say, okay, well, if people don't want contact, okay, what can we do for that? Okay, well, and again, I keep using the interview on weekends thing because I think that's a really great idea. But okay, well, maybe you can come on the weekend and and interact with us in that way, and so it's a limited exposure and all that kind of good stuff. So so really just tackling the challenges one by one, and having them say, okay, well, what did you do pre pandemic? How was your role? What were your roles then? And really taking a look at that way. And it really seems oversimplified, but I think sometimes if you make it, if you get back to the basics and figure out how you can change and, be agile to that particular issue, then they'll really be able to figure out a plan that might help them do that, overcome that certain challenges. So, and, when we talk about using a workforce recruitment and retention plan, there are a lot of things that it can do. And even in the midst of all these changes in the global pandemic, it's going to allow you to do all the things that, it was intended to do. It can, you can track your successes. You can look where you need to grow and the opportunities for change. You can look at the data and figure out where you could go from there. And then also finally, you can really ensure the alignment with your goals, because ultimately you want to be recruiting, or health centers want to be recruiting mission-driven individuals, that they aren't just hiring because they're having an emergency situation and they need to do it. Obviously there might be situations where they need to hire a locum, but if they're going to have a permanent placement, they really want to make sure that they're hiring the people for the right reasons and that they are hiring people that are really good fit for their organization. And before we get to retention, I just want to touch on this on recruitment team roles. And so this is another thing that health centers might be changing right now, and they want to take a look at as relates to recruitment, because things are changing so rapidly, right? And so those people who might have done these particular roles, whatever they might be, you just want to think about how they could think about how they could shift things and to overcome these recruiting challenges, especially if if some people are remote, some people are in person, all that kind of good stuff. So really think about how the recruitment team can play a part of that and help the health centers really to really leverage their strengths, but also react to the changing environment there. All right, so we're going to do the same thing with retention now. So let's take a look and think about how retention has been affected during the COVID-19 pandemic. So many different things. This honestly doesn't even begin to touch it as far as what the issues are, right? As far as retention. So a lot of people have changing schedules due to childcare or other, familial commitments that they have, right? So they just physically can't be there, especially last spring as literally all the schools shut down and everything, and the people continuing to need, they have remote learning and their schools are not physically open and they just can't leave their small children at home there. And so and then also some people are just leaving the healthcare industry because they just feel like they just can't do that. They could be changing a job to find a less demanding position, whether it's, if it might be a specialty practice or something like that they're going into. And then obviously burnout is a huge issue. So many things that are going on and retention issues relating to COVID-19. And I would love to hear from you guys about how COVID has affected retention at your health centers. And so I'm going to go back to our Mentimeter screen, and it should be the same there. It should be the same code and everything, so you just can go back to that tab in your browser. But I would love to hear from you guys. What have been some of the biggest retention challenges as relates to COVID-19 with health center workforce? Or if you haven't found that retention has been an issue, I would love to hear that too.
One thing I was going to add, I think with COVID, as we looked at some of the other slides where people talked about hiring freezes, it shows how retention and recruitment cannot be separated from each other, because if you're going through a hiring freeze, then you also want to make sure that you have the right people staying. So true. Okay. So Judd mentioned that they're keeping employees who didn't want to do COVID testing. So that's been an issue, right? So trying to figure out how, if they really have an objection to doing that, trying to figure out where to redeploy them at their health center, right? So they can keep their job, but they really are opposed to doing that COVID testing for obviously a lot of reasons, and how to do that. So that's, yes, definitely a huge challenge. Childcare, yes, huge. Now I think more childcare centers have opened up, but that it's still an issue because it's cost factor, all that kind of good stuff. MA turnover. Yes, I have heard, Shalena, I think that's been universally, I can't say that for certain, but I would say that a lot of people, the MAs and obviously the dental assistants, but especially the MAs, the turnover I think it's always a problem, but or from what I've heard from folks, that the MA turnover tends to be an issue anyway, but that this has just exacerbated that issue. Any other aspects of retention? All right. Okay, so support staff, just like what Shalena
talked about when it comes to MA turnover. Yadira from Washington also said that support staff turnover is an issue, but it hasn't been an issue with providers. And that could be due to unemployment being higher during this time. It could be that they have other obligations that they just can't be there. But that's really interesting that the support staff has been more of an issue than providers. So, and that makes it hard too, because all of the different parts and all of the roles at health centers are important. And so if you lose half of your support staff, then it's just hard to keep the, everything going. All right. So Rosa from North Carolina said, burnout and mental health has affected staff. They have identifying ways for health center leadership to incentivize and praise staff. Yes, absolutely. Going a long way, and just like, thank you, all of that, keeping folks going is hard, especially now that we're a year into it. I feel like that it's not, the shock of it all has worn off a little bit, but it's the continuing day to day of, okay, we're in it, we're keeping on going, and it's making folks weary. That's really hard too. Okay. Childcare for an Iowa childcare staff out for quarantine. Yes, another huge issue. Quarantine has been really, really big. And also too, I've heard that, I don't know if you guys have heard this too, but it's not necessarily a retention, but just kind of a staffing issue, is that when health centers were vaccinating their staff, that they were having to be out because of having symptoms afterwards, especially their second vaccination. So yes. All right.
Suzanne,
Awesome.
I would also want to raise, also just building onto the burnout issue, some of the things that have been coming up in some of my conversations with health centers as we're planning different trainings. It's interesting to hear about burnout in terms of, we're not preventing burnout anymore. We're basically helping people work while they're burned out. So there's a whole different way that we're interacting with people. So I was speaking to a couple of nurses at a health center that are going to be speaking at an upcoming webinar, and they're just like, no, we're already burned out. And some of the things that they have available to them to support them are either not accessible because they don't have the time, because they're so busy, with vaccination rollout, or two, they're some of their colleagues who used to join them in happy hour, or they said they even used to do line dancing at work, just like, fun little things that kind of kept their spirits up. They're not around anymore because they have less staffing in the facility. And so they've just, all of that has been halted or postponed until things get back to, more office-based staffing. And so as we're thinking about, how it is that you engage with people who are already burned out and just barely hanging on, it's different than how you would engage with people who, are not burned out, but otherwise working in a busy environment, even down to communication, because that they're not processing information like you would if you weren't burned out and stressed out and feeling overburdened.
That's such a great point. Thank you for bringing that up. And absolutely. And this is kind of out of context, but I will put a plug now for it, that we do have an upcoming webinar series on mitigating burnout during the COVID-19 pandemic and beyond. So stay tuned for some more information on that. It should be out in the digest fairly soon. And another reason to sign up for our newsletter if you haven't. So thank you, Sabrina, for that. Appreciate it. All right. Thank you so much for sharing. Okay. So again, how can we help you help your health centers? So again, really look at their, thank you, Mariah, for putting that link in there. So really, honestly, just get back to basics. There are so many things that, we can do during this time. And, as Sabrina mentioned, realizing that people are already there. This is not something that, we're trying to necessarily, prevent, but just trying to help them cope through it, right? And I think, you know, for all of us, we can say that we are not the same people that we were a year ago. And not that that's necessarily always a bad thing, but we're just not. And so figuring out how we can get back to basics and really figure out all of these things that are in our template, and to really integrate them to what is going on and how you can interact with them. So some of the things that come to mind for this are, you know, training. How can you help folks, you know, train for the jobs that they're being asked to do? You know, someone said that they didn't want to do COVID testing, but if a health center employee needs to do COVID testing, then make sure they're adequately trained. You know, again, if they're asking to pivot to vaccination, like make sure that everybody on your team knows how that the vaccinations are going to go, and all of that too. You know, helping them have adequate time off. This goes in that benefits, you know, thing, and really having people take time off, saying, okay, you really need to take time off, whatever the interval is, really help them take time off. So that, you know, even if it's just a day, so that they can, you know, just like get out of that environment of just, you know, and being in the middle of it. Also to recognition and also communication. That's kind of in sort of the missional part of it, I would say, goes into the mission category, or can. And, you know, those two things are really, really important. So just recognizing, just saying thank you, writing a note, all of those different things, really crucial to helping them know that the health center cares, that they don't just think that they're a machine, right? And, you know, someone, you know, I'm sure that folks will, you know, expand on this during our webinar series, but just really helping, you know, having that constant line of communications, really just having that appreciation. And again, it doesn't keep people from being burned out, but it also, you know, if someone says thank you to you, it makes, you know, makes you feel good. And so by doing that and, you know, recognizing what they're doing and really communicating that, is really important. And a couple other things that we have that can go along with those back to basics and your retention plan are flexible schedules too, to the extent possible, really offering those flexible schedules. And that's kind of a benefit there. And then also, you know, mental health support. You know, if there's anything that you as a or that your health centers can do to really support them, it's super important. And you know, it gets a little tricky because if you have mental health providers, if they have mental health providers at their health center, you don't necessarily want their colleagues to be providing them support, but trying to figure out ways where, you know, they can support themselves, and, you know, and all of that. So that's definitely crucial during this time.
Suzanne, I just wanted to add on the mental health component.
Yeah, please.
I think also, you know, obviously a pandemic is not something that anybody expects, or, you know, we can plan it out basically that it's going to happen. Yeah. And when we look at the mental health of the staff, what they've been going through, it's also kind of understanding the different stages of what they're experiencing. So definitely, you know, in crisis mode, people go into that fight, flight, or freeze response. So it's always go, go, go. I have to figure out. So that is really creating an increase in anxiety, increase in, you know, different things that are then affecting the health center workforce. And then as things sort of start to settle, you start seeing more of those components of kind of how Sabrina talked about, that it's not preventing burnout anymore. Burnout is there because it was just, you're at that stage and that's going to happen. So you can really modify that assistance that you're providing to your staff in really understanding where they're at in that sort of mental health continuum, and be able to provide them the resources that they need, but also make the systemic changes in order to take care of them and their well-being.
Awesome. Yes, thank you for expanding on that, and appreciate your expertise in that area. And it really is important to, you know, evolve and really figure out where we can help folks best, and depending on what stage they are in. All right. Well, thank you guys all for engaging in this conversation. I know it's an ever evolving topic that we're really talking about, and figuring out the best strategies aren't universal, just like with, you've seen one health center, and that really is so true. But hopefully this, conversation has really maybe, sparked some ideas on, if folks come to you for help, that you can, that you can give them some new ideas if you haven't ever. So, okay. So I got a question that I will, since I'm going to questions, there was a question that came into me. It said, do you know what folks are seeing for the overall recruitment process for sites that are hiring? Are health centers conducting in-person site visits? Are they hearing that sites are conducting the entire recruitment process remotely? That's a great question. And I would say that, again, everything is evolving. And I think that most folks, I can't, say for sure, universally, but I would say that most folks are probably doing at least some of their process over Zoom or things like that. But as things tend to open up a little bit more, and the vaccine is rolling out, and folks are more apt to travel, especially those folks that have been vaccinated, I would think that if someone is looking at relocating, as things begin to open back up, that they're probably going to be looking at more, having that in-person component again. Obviously it varies from area to area, state to state, region to region, but I would think that things would, get back, travel, people are starting to travel a little bit more. So I would say with, again, depending on the health center, but it would probably tend to open up a little bit more again there as well. So hopefully that answered your question there. Any other questions for either myself or the rest of the amazing STAR Center staff here about recruitment and retention during this time? All right, so you guys know all of our resources that we have. So I mentioned our template again today, and then we also have some other resources that go along with that template that can help as well. One of the new things that we have, podcasts were new to us last spring, and we have a new season of podcasts. Our podcast is called STAR Center Talks Workforce Success. And this season, it is focused on COVID-19, as you can imagine. So Michelle is leading that effort for us, and I will give her just a minute to chat a little bit about what the details about the sessions there.
Thank you so much, Suzanne. So I got a notice that said my internet is unstable. So I'm going to stay off camera, but I do want to talk about the podcast. So we have 5 upcoming episodes. 2 have already been posted. And, we really are talking to people all across the spectrum of the health center workforce as to how COVID has affected them, has affected their staff, and the services that they provide as well. So the first podcast is focused on a chief human resource officer, and she talks about really that connection between workforce and how well-being is a key part of everything that you do. And she goes into that you can not only just focus on the well-being of your staff, but you also have to focus on your own well-being in order to impart that on your staff. Our second interview was with a director of the substance use program at a health center who tested positive for COVID, and she shares her personal experience of what it was like to go through that and be a staff member. And then the next 3 episodes that we have coming up, we will be talking with a dentist at a health center to speak to what is the role that dentists play in this. So, with vaccines, with testing, how do they speak to their patients, and just making also the patients comfortable in coming to the dentist during a pandemic. We're also going to be speaking to a CFO who, when she reached out to us, said, I'm so interested in the well-being of my staff. And I know that that's kind of strange, maybe for a CFO. And I wrote back and I said, no, it makes perfect sense. And she's like, it impacts all of our operations of the health centers. So we need to take this very seriously, and we need to make sure that we're there for our staff. And then the final interview will be with a provider at a rural health center. And again, it's just talking about how this impact has really affected the workforce. And I'm sorry if I skipped out on anything, because I keep getting the internet is unstable. So I hope all of you were able to hear me. And Mariah put on the chat oh, sorry. Were you able to hear me, Suzanne?
Yep, I can hear you.
Oh.
Yep. Yes, thank you so much for sharing all of that, Michelle. Yeah, yes. You're cutting it in and out a little bit. I think we're all having internet issues today, so sorry about that, you guys. But yeah, thank you so much. Michelle's done an amazing job with those podcasts, and you can listen to all of those there, as well as, pass them on to your health centers if they're interested to hear about how other health centers are, managing and, frankly, thriving during this time. You can absolutely do that there. So that's been kind of a fun addition to our resources there. And then next time is our last session of this budget period. So we are going to be talking in April on the 8th at 3 o'clock Eastern, all about the DEI lens as an essential part of retention and recruitment. So you don't want to miss that. So we have Sabrina and Michelle teaming up for that presentation. I'm really, really excited about it. And you don't want to miss it. So as we wrap up here, Mariah has put the evaluation for today's session in there. Please go ahead and take a minute before you log off to complete that. We really, really appreciate it. Thank you guys so much for your insight today and doing something a little bit different and really contributing to the session and just sharing what you all were seeing as far as recruitment and retention during this time. And if you guys need anything from us, you can always contact us. Our contact information is in the slides, and you can always reach us at info@chcworkforce.org. So again, thank you to the STAR Center team, as well as you guys for the PCA and HCCN staff for being on today. And we look forward to talking to you on April 8th, if not before. So I hope you guys have a wonderful afternoon, and we'll talk to you soon.